Bravo, George Mason!
How dare they? President Obama, Democratic leaders have decided to bypass a formal House and Senate conference committee in order to reconcile those two health care bills. Instead, White House and Democratic leaders will hold informal, that's another word for secret, negotiations, meant to shut Republicans and the public out of the process.
And right now, we are at the point where we are going to do something historic this weekend. That's what this health care vote is all about.
Joining us now is Betsy McCoy. Betsy's New York's former lieutenant governor, now chairman of the Committee to Reduce Infectious Deaths. Betsy, thank you for being with us today.
Well, you're quite welcome. I'm glad to be on because I have just finished reading the new House bill for health care, what they call reform.
It's a debate that's not only about the cost of health care, not just about what we're doing about folks who aren't getting a fair shake from their insurance companies. It's a debate about the character of our country, about whether we can still meet the challenges of our time, whether we still have the guts and the courage to give every citizen, not just some, the chance to reach their dreams.
I am so shocked at the vicious assault on elderly people and the boomer generation in this bill. And I hope that people listening will protect their parents from what is intended under this bill.
Because if this vote fails, the insurance industry will continue to run amok.
Now we are all locked in. We're locked in into a monopoly system, a system that's broken, Alex. I mean, it doesn't even work.
Every proposal has been put on the table. Every argument has been made.
This bill is half paid for with a $500 billion cut in health care benefits and services for seniors. So they're bearing half the brunt of this bill themselves.
The insurance industry and its supporters in Congress have tried to portray this as radical change.
All these drugs and surgeries and medications and vaccines, this is what we're being forced into without a choice?
Now, I just want to be clear, everybody, listen up. Because we have heard every crazy thing about this bill. You remember.
1% of those cuts will eliminate fraud and waste and abuse. That means they're really cutting patient care.
First, we heard this was a government takeover of health care.
The medical system, the monopoly, cannot afford to let Americans have a free choice.
Then we heard that this was going to kill Granny.
And one of the most shocking things I found in this bill, and there were many, is on page 425, where the Congress would make it mandatory, absolutely required, that every 5 years, people in Medicare have a required counseling session that will tell them how to end their life sooner.
Then we heard, well, illegal immigrants are going to be getting the main benefits of this bill.
They cannot let people have that free choice because the cancer industry would lose money, the pharmaceutical industry would lose money, they would lose patients out to natural medicine.
I don't believe we should give government or the insurance companies more control over health care in America. I think it's time to give you, the American people, more control over your health.
How to decline nutrition, how to decline being hydrated, how to go into hospice care. And by the way, the bill expressly says that if you get sick somewhere in that 5-year period, if you get a cancer diagnosis, for example, you have to go through that session again, all to do what's in society's best interest or your family's best interest and cut your life short. These are such sacred issues of life and death. Government should have nothing to do with this.
It's gonna change healthcare in 3 ways. Number 1, we are going to end the worst practices of insurance companies.
Any real health care reform, Alex, should start with nutrition so that we can prevent disease and prevent these costs and prevent our nation from going bankrupt from health care costs.
The second thing that would change about the current system is that for the first time, small business owners and people who are being priced out of the insurance market will have the same kind of choice of private health insurance that members of Congress give to themselves.
The government doesn't want you to be healthy and happy. They're poisoning people by design and pushing Ritalin and Prozac on the population.
Yeah, that's right.
The IRS now controls what medical care you get. That's not rhetoric. That is the legislation.
What we're doing is we're taking money that America's already spending in the healthcare system, but is being spent poorly.
Well, this bill is devastating to alternative care, Alex, because it excludes it. So it doesn't have any provisions for covering chiropractic care, for example, or acupuncture, or even nutritional medicine. It doesn't do anything to help Americans take care of their own health.
We're not taking out the credit card in your name, young people, and charging it to you. We're making sure this thing is paid for.
Can you imagine the response of the American people
Yes.
when they find this out?
Well, I hope they do find it out. And this is just the latest dangerous, very dangerous assault on the elderly. You know, way back in February when the stimulus bill was passed, there was slipped into that bill something called comparative effectiveness research. Now that sounds good, right, Fred? You'd want to know which drug or which device works best. But this is generally a code for denying care based on a patient's birth date.
Now the third thing this legislation does is it brings down the cost of health care for families and businesses and the federal government. And altogether, our cost-cutting measures would reduce most people's premiums, and here's the bonus. It brings down our deficit by more than $1 trillion over the next 2 decades.
So treatments for age-related diseases like macular degeneration or Alzheimer's or osteoporosis, those treatments are often turned down in England, where this formula is widely used, because the elderly patients have too few years left to benefit. They've got a denominator problem.
What does this mean in November? What does it mean to the poll numbers?
What a far cry from the election, when then-candidate Obama pledged to, quote, broadcast health care negotiations on C-SPAN so that the American people can see what the choices are, unquote.
What's it going to mean for Obama?
President Obama hasn't even made a token effort to keep his campaign promises of more openness and transparency in government. It was all just another lie that was told in order to get elected.
That's what they like to talk about. I understand. Yeah, one of the things you realize is basically that a lot of reporting in Washington, it's just like SportsCenter. You know, it's considered a sport. And who's up and who's down, and everybody's keeping score, and you got the teams going at it, rock'em sock'em robots, you know.
All it really accomplishes is trapping Americans in a system of disease and sickness and bankruptcy.
I don't know what's going to happen with politics on this thing.
And just one example of how this is going to work, in 2006, the British National Health Service issued an edict using comparative effectiveness research. They issued an edict that elderly people with macular degeneration, that's a condition that causes blindness, couldn't get a new drug to save the vision in one eye until they'd already lost their vision in their other eye. Can you imagine? They had to go blind in one eye before they were eligible to get this drug, because that was the cost-effective way to do it.
You know, the naysayers said that Social Security would lead to socialism. But the men and women of Congress stood fast and created that program that lifted millions out of poverty.
The head of C-SPAN wrote a letter, asked Congress to, quote, open all the important negotiations, including any conference committee meetings, to electronic media coverage, unquote. When White House Press Secretary Robert Gibbs was asked whether the administration would support televising the negotiations, he refused to answer, instead mumbling something about, well, I haven't seen the letter. That wasn't the question, Mr. Gibbs. You either support openness or you don't.
There were cynics that warned that Medicare would lead to a government takeover of our entire healthcare system.
The Democrats insist this is all on the up and up, with House Speaker Nancy Pelosi saying, quote, there's never been a more open process for any legislation, unquote. Oh, really? This is the same Nancy Pelosi who, you may recall, after becoming Speaker in 2006, promised the Democrats would have, quote, the most honest, most open, and most ethical Congress in history, unquote. Here's hoping the voters remember some of this crap when the midterm elections roll around later this year.
And if you believe that it's right, then you've got to help us finish this fight. You've got to stand with me just like you did 3 years ago and make some phone calls and knock on some doors, talk to your parents, talk to your friends. Do not quit. Do not give up. We keep on going. We are going to get this done. We are going to make history. We are going to fix healthcare in America with your help. God bless you. And God bless the United States of America.
It makes it clear that you cannot keep your health insurance. You're going to be forced to switch to a low-grade HMO-type plan that's going to limit your access to specialists and tests, and you're going to pay a lot more in higher taxes for this health plan you don't want.